If you or someone you know is 60 or older, pause here and consider this. Talk to your doctor before making major changes to your diet. This video is for educational purposes, not medical advice. Click subscribe and hit the bell icon now, because today's message could protect your life. If you're over 60, what you eat tomorrow could determine if you ever see sunset again. Meet Evelyn Harris, age 68. Evelyn was always active, daily walks, gardening, volunteering at her local church. But one evening, she felt numbness on one side of her face and slurred speech for a moment. She dismissed it a bit, maybe fatigue, dehydration, she thought. The next morning, she woke with a pounding headache and went straight to the ER. A brain scan confirmed what she feared. She had suffered a mild ischemic stroke. Her cardiologist, Dr. Liu, ran a battery of tests. Evelyn's cholesterol, blood sugar, and blood pressure were within acceptable limits. But one finding puzzled him. Her International Normalized Ratio, INR, a measure of clotting balance, was creeping upward. She was on a mild antiplatelet agent, aspirin. Already, he asked about her diet and supplements. Evelyn confessed she'd recently started a superfood greens regimen, consuming massive quantities of kale, spinach, and collard greens daily, believing it would flush her arteries clean. She also began using powdered greens and smoothies with broccoli, Brussels sprouts, and cabbage. She assumed all vegetables were harmless. Dr. Liu paused, then explained something Evelyn didn't expect. Yes, green leafy vegetables and certain cruciferous veggies are rich in vitamin K. In patients on blood thinners or with delicate clotting balance, sudden surges in vitamin K can interfere with a delicate equilibrium, sometimes tipping the scale toward unwanted clot formation or destabilizing anticoagulant effects. Over weeks, that shift may raise the risk of thrombosis or stroke. Evelyn's story shocked the local seniors group. Some dismissed it as rare, but Dr. Liu used it as a teaching moment. We're not saying never eat greens, but we must recognize risk, drug interactions, and the fragile balance in seniors' circulatory systems. 1. Aging vessels and the clotting balance. As we age, blood vessels lose elasticity. The endothelial lining is more fragile, inflammation is more common, and microinjury accumulates. The older body also has reduced ability to dissolve clots, fibrinolysis, and increased expression of clotting factors, like factor VIII fibrinogen, and inhibitors of fibrinolysis, e.g. PAI1. Older age is a known risk factor for venous thromboembolism, VT, and stroke. Notably, in large cohort studies, higher fruit and vegetable consumption is generally protective against VT and cardiovascular disease. So the claim must be carefully framed not to contradict strong epidemiological trends. Therefore, to make a provocative claim like, these vegetables raise stroke risk overnight, it must apply in specific high-risk contexts, e.g. on anticoagulants, sudden diet changes, genetic predispositions. 2. Vitamin K and blood clotting interplay. Vitamin K is a key cofactor for clotting factors 2, 7, 9X, and protein C and S, which regulate coagulation in people taking warfarin or similar vitamin K antagonists. Inconsistent intake of high vitamin K foods, like leafy greens, broccoli, Brussels sprouts, can lead to fluctuations in clotting potential, either undercoagulation, bleeding, or overcoagulation, clotting. Even those not on warfarin may be in a delicate balance if they have borderline vascular disease, silent, atherosclerosis, or subclinical coagulation activation. 3. Gene variants and clot risk. Recent research has identified gene variants, e.g. in ABO, F8, VWF genes, that amplify clotting risk, some raising the risk of venous thrombosis by up to 180% in an older adult who carries such variants. Any added clotting stimulus, e.g. more vitamin K, can tip an unstable system. Also, ultra-processed food consumption has been modestly linked with clot risk in some studies. 4. Studies and paradoxes, vegetarians and clotting markers. A 1999 study comparing vegetarians and meat eaters found that vegetarians, especially vegans, had higher platelet aggregation responses to collagen and ADP stimulation, a surprising paradox. Other studies show vegetarians may have lower markers of hemostasis, a favorable profile, compared with non-vegetarians. The conflict suggests diet interacts in complex ways with clotting, genetics, and medication status. 5. What cohort studies show? Large respective cohorts, e.g. ERIC, light, observe that higher fruit/vegetable consumption is associated with lower incidence of VT and related vascular events. Yet, these are observational, so they do not exclude subpopulations in which specific vegetables or abrupt changes may be harmful. The 5 vegetables that raise stroke risk overnight in high-risk older adults. Kale, extremely high in vitamin K. Sudden high doses may destabilize anticoagulant drug balance or tip the clotting equilibrium. Spinach, rich in K1 and nitrates, often used in green smoothies in concentrated form. Brussels sprouts, a cruciferous veg with decent vitamin K content and compounds that modulate liver enzymes. Broccoli/broccoli rabe, helpful overall, but in supplement or juice form, dosage spikes can influence K-dependent pathways. Collard greens/mustard greens, common in southern diets, rich in K and distinct phytochemicals that can interact with metabolic and clotting pathways. Why overnight? Because in a sensitized, older circulatory system, a sharp surge of a high K vegetable or their concentrated powdered/juice forms may shift clotting balance quickly, pushing a marginal system over the edge, especially in someone already on antiplatelet/anticoagulant therapy or with other vascular disease. Mitigation, safe use, and practical advice. This is where you pivot from fear to empowerment. Give viewers steps to protect themselves. White heavy checkmark 1. Maintain diet consistency. If you consume vitamin K, rich veggies, kale, spinach, broccoli, do so in moderate and consistent daily amounts rather than large sudden spikes. For warfarin users, synchronize with your INR monitoring. Avoid sudden increases or decreases. And white heavy checkmark 2. Communicate with your doctor/pharmacist. Let them know any new supplements, powdered greens, or juicing habits. Ask whether your medications, warfarin, dokes, antiplatelets, are sensitive to vitamin K. White heavy checkmark 3. Prefer whole foods over concentrates. 1 cup of cooked greens is safer than a high-potency green powder or juice kale shot. Whole foods include fiber and moderating compounds, while powders concentrate specific nutrients. White heavy checkmark 4. Regular monitoring and biomarkers. Seniors should track blood pressure, lipid panels, HbA1c if diabetic, and kidney function if on anticoagulants. Monitor clotting parameters, e.g. INR, more closely when you make dietary changes. White heavy checkmark 5. Lifestyle measures that reduce clot risk. Stay mobile. Avoid long periods of immobility, sitting flights. Keep hydrated. Maintain a healthy weight. Avoid smoking. Manage blood pressure, cholesterol, sugar. Consider mild natural antiplatelet foods, garlic, turmeric, ginger, with your doctor's oversight. Mr. Franklin's wake-up call. John Franklin is 70. He's been on low-dose aspirin for years after a minor cardiac event. He's health-conscious. Morning gym, kale smoothies, green powders, broccoli, and collard greens in huge servings. He began using a new Super Greens powder concentrate. After about 2 weeks of this new regimen, he complained of slight dizziness, mild chest tightness, and then numbness in his right hand in the early morning. He drove himself to the emergency room. A CT scan ruled out hemorrhage but found a small ischemic stroke in a border zone area. His neurologist asked, "Had John changed anything?" That's when John confessed his health upgrade. The team reviewed his clotting labs and noticed his platelet aggregation and clotting factor levels had subtly shifted upward compared to previous baseline. Over the next few days, they reversed course. John was put on a monitored antiplatelet regimen, and his greens were reduced to consistent, moderate amounts. He was counseled to coordinate diet with lab monitoring. John recovered well, but he often tells others, "Greens are good, but in my case, too much, too fast nearly tipped me over." Use a story like this to help viewers see themselves in the scenario. It heightens emotional impact and encourages them to stick around. Don't gamble with your circulatory system. Talk to your physician or a registered dietitian before making sudden changes to your vegetable or supplement routines. If you found this video eye-opening, share and subscribe. Help someone else over 60 avoid a silent danger. Drop a comment. Which vegetable surprised you the most? Let's talk about safe greens.